Thanks, Bob. With all due respect, I'm going to make one correction, but before I do that, I'm going to note that at table 6, we didn't need a millennial because we had Bob, who is the most prolific tweeter of probably everyone in this room. So the one correction I want to make is actually the Office of Health Systems didn't launch the HFG project. It was actually launched in the hidden office, and I was there, and so now I feel like I've come full circle to close the project as part of the Office of Health Systems. But I also think that's reflective of where we've come with health systems in the last 6 years. I think over the last 6 years, the global community has really recognized the importance of health systems. That's reflected in Usaid creating an Office of Health Systems, but also just more and more conversation and recognition of the importance of health systems to achieving development goals as well as health goals. And I think a large part of that is due to HFG. HFG has raised the profile of strong health governance and country health financing approaches as critical to achieving sustainable and continuous improvements in health systems, and is a critical step towards self-reliance and reducing donor dependence on assistance for health. We are reminded by our new administrator that the purpose of USAID, U.S. development assistance, is to help put countries on a path to self-reliance where they can plan, manage, and resource their own further development. Within the health sector, you cannot do this without health systems and without health system strengthening. I think also health systems are reflective of the overall purpose of U.S. foreign assistance, which has dual objectives of both improving lives of people in the developing world and also furthering U.S. domestic interests. And I think those health systems in that respect is critical to achieving strong economies, good governance, making sure that populations and citizens can rely on the health sector as one of the key sectors that affects their daily lives on a day-to-day basis and gives them confidence in their governance and their governments. So again, health systems, I think, is critical to health. It's critical to development. It has gained in prominence and is continuing to gain, and that is in no small part due to the work of HFG. Through projects like HFG, USAID helps countries, their peoples, and institutions improve health outcomes over the long term. We help countries identify and take ownership for investments in their health systems. We partner with both public and private sectors. We seek to ensure affordability, quality, and delivery of health services in an equitable and sustainable manner. And ultimately, this works to protect people against unforeseen health and financial shocks. So I know today will be very rich in discussion, but just to highlight a couple of key examples that I think illustrate these points. HFG has done tremendous work in linking the importance of health systems to our health outcome goals. HFG conducted a robust literature review, which has been larger than any to date, that comprehensively assessed the impacts of health system strengthening on health outcomes. Some of the findings include the association of reductions in morbidity and mortality with community-based packages of maternal and newborn health services, with conditional cash transfers, the integration of services, and health insurance schemes. These findings and more were published in the Impact of Health System Strengthening on Health report. This is also what formed the basis of working with UNICEF to adapt their EQUIS tool to really talk about and model the impacts of health system strengthening on health outcomes, and particularly on child and maternal lives saved. I can't underemphasize how important this work is to the overall community. I think that those of us in this room, I'm sure, have long recognized the importance of health system strengthening, but I think really being able to link it directly within the health community to our broader health goals has served as part of this overall theme to really elevate the stature of health systems. On a similar theme, HFG has been instrumental in linking participatory health governance to health outcomes. HFG helped USAID identify gaps in research and for health governance activities, and reviewed the body of evidence for participatory health governance and its effect on health outcomes through the Marshalling the Evidence initiative. We now have concrete evidence to point to about what works in governance for health outcomes. Again, I think we all knew that governance was important to broader development objectives and important to health system strengthening, but now we can point to specific interventions and specific methodologies and aspects of how we implement our governance activities to really also contribute to improving health outcomes. Finally, HFG has had important progress on country level. For example, community-based health insurance in Ethiopia. HFG led efforts to help the government of Ethiopia design and evaluate community-based health insurance pilots beginning in 2010. And then over 5 years, the community-based health insurance program was expanded from 16 to 191 districts and now covers 17 million Ethiopians. So that is a tremendous success story, and I think very indicative of the goals that we're trying to achieve in health system strengthening, including financial protection, equity across the population, and quality of services. So overall, I want to applaud the HFG project for the important work accomplished to elevate countries' awareness of the criticality of governance and health finances approaches that ultimately will help countries transition away from dependence on donors for health funding and enable countries to resource plan and manage their own further health development. So we're here today to celebrate the accomplishments of HFG, but also to generate dialogue on new ways of thinking and things to look forward to. And I was very impressed with, they're not up there anymore, but all the sort of excitement in the room for the conversations for the day and the hopes for where this dialogue can take us. So thank you for joining us, and I look forward to a very productive day.